Dr. Chiu, I'd like to talk to you about the intake of vitamins, especially like vitamin E, before and after a surgery, be it a gum disease, be it a wisdom tooth, be it a normal type of tooth extraction, or maybe a bone grafting, where the bone was shrinking and you needed to put on more bones in order to put an implant in it and stuff like that. How do you feel about that? Personally, I believe, that's my, of course I've read it and have whatever, but personally I believe that taking especially vitamin E, of course you got to take it for at least a week before, ideally all the time, and a fair amount, makes healing faster and brings the pain throughout the operation down. Do you have any experience like that? What's your take on it?
I totally agree. Vitamin E, that does help you, your tissues heal faster, and recover faster. So it is helpful having vitamin E in place when you do any type of surgery or even bleaching. After bleaching, you might have some white blanching here and there. With vitamin E, we can just remove that blanching of the tissue right away. So it does help recover the tissues much faster.
Now, I didn't quite, because we seem to have not the super best connection here right now, but did you say just the word vitamin, or did you add vitamin E to it? Did you validate the use of vitamin E now, or just vitamins? What did you say?
Vitamin E.
Okay, vitamin E. All right. Yeah. Do you have any recommendation from your part of how much, how long before they should take it? And again, if it does something like that, personally, I would say everybody should take it all the time. I do for sure. I take 800 a day, even though some people say that this is fat solvent and it's too much. I just don't believe in that. I take about 400 twice a day, and I take it more or less all the time, except a few times I don't take vitamins at all because I forget or I'm too lazy. But on an average, I'm doing it, 4, 5, 6 days out of a week continuously for decades now. What's your opinion about that?
About 800 milligrams a day. It sounds about right, and it's not helpful. It's not harmful to take vitamin E. So it has a lot of benefits taking supplement vitamin E. So 800 is about the correct amount.
Mm-hmm. In fact, since we're on that topic, even though it's not complete dentistry, but we all have heard that vitamin C keeps colds away and all that type of stuff. And yet many people say, no, it doesn't do anything for me. Now, personally, when I check into it, a couple things happen. Number one, they simply don't take enough. They actually think when they drink an orange juice from the store, there's enough vitamin C in it. There just isn't. There's not even enough vitamin C. In fact, there's so much extra sugar in it that's not even real. But the point is, even if they take a few oranges, it isn't. Or when they take tablets, they take like 400 or 500. Again, Mr. or Doctor or Professor Pauling, is that the gentleman who kind of came up with the vitamin C formula? I think he talked about 8 to 10,000 milligram a day, and that is how much I take. And he says about that, if and when your body is in good condition. So anyway, people don't take enough, but there, apparently from Professor, PhD, Dr. Parker from the Parker Institute in Berkeley, he wrote a book called The Miracle of Vitamins, I think, or of Antioxidant or something like that. And he says one of the reasons sometimes vitamin C doesn't work no matter how much you take is because the body is lacking vitamin E. And when you ask him how do you know your body is lacking of vitamin E? You say, never mind, just take it. And then vitamin C will have lots more workability. Have you heard about that? I've read that. That's, it's what, as I said, Mr. Parker has read that. The not enough taking makes a lots of sense to me. and that vitamin E not only gets pain down and makes healing faster, but also makes vitamin C work a lot better. Seems to be a nice added benefit to me, if there's any truth to it.
I do believe it's true too. I think both of those vitamins are very important for the healing. So taking combination is a very good thing to do to help the body heal faster. Yes.
Well, good. So here we have it. All right. So the good nutrition and get it via vitamin, and especially if you have a surgery ahead, start taking that stuff a week before, because it does take a while to get into the body, and a week is a bare minimum kind of, and then take it afterwards, and maybe people see a noticeable difference there, and then they just kind of hopefully keep taking it all their life. Thanks a lot, Dr. Chiu.